complex. So is our mental health. It cannot be understood by diagnosis alone. Our philosophy is treat the person, not the mental illness.
Hello, everyone, and welcome to another episode of Humanizing Mental Health. I'm Jeremy Alcorn.
I'm Trent Akers.
Today, we are joined by a good friend and colleague of ours. We all work in the Synergy Center. And Anna Schlosser, I always say your name wrong.
That's close enough. Schlosser.
See, there we go. There we go. At least I call you Anna, not Anna.
True. Yeah. Indeed.
Is joining us today. Anna is actually has a very specific skill set that is uncommon because there is an area of practice that hasn't been pursued for actually some time, mostly because there was a war on drugs that prevented that from happening. And if you don't mind, if you could tell us a little bit about that.
Sure. So I have training as a psychedelic integration therapist, and essentially what that is helping people make change in their life, actionable change after having psychedelic experiences. So not always just including plant medicines, but sometimes including MDMA or LSD or just a variety of substances that they use to try to essentially level up, work through trauma, addictions, things like that. So ketamine being one of those as well. So I think we're in a sort of a resurgence, renaissance of psychedelic medicines as healing agents. And here to talk a bit about that and maybe answer some questions, raise some questions, and
Yeah, so right off when you say that, I think for the average person, because since I've known you, Anna, I've dived deep into this myself, and you've really helped me in my knowledge. So what is the real difference from your point of view between the way that you would use these substances versus casual or recreational use?
So there's some considerable differences, and this is a question that comes up a lot, actually. So how is this different than someone who's just sitting around using drugs recreationally? So one of the main differences is that they're used in oftentimes in a setting that's supervised by a medical professional and potentially a counselor. And I'll talk a little bit about the changes in Health Canada legislation that happened in January. But another difference is that often dosing is a major factor that's considered. So oftentimes when people are using substances recreationally, they don't actually know what dose they're taking. They're just, licking their thumb and dipping it in the bag, and whatever comes out is what they get. And or their substances are mixed with other substances, and they don't always know and aren't always testing. So the sourcing is also a really important factor where, much like cannabis now, there's regulated providers of these medicines, and that's going to continue to grow. And I think over time, probably not that long, honestly, in the next year or so, we'll be seeing psilocybin mushrooms in dispensaries where cannabis is sold. We actually already see that in some other areas of Canada, and so it's just a matter of time.
Oh, that's very interesting. Now, I want to link into something that you just barely mentioned. So as you start to talk about the difference between just simply street use and a therapeutic use, you're really talking about kind of having a sense of guidance, but also a position in which there's appropriate controls around the experience. And you just mentioned changes in legislation, which is one of those functions of control. What are those changes that are happening then?
So previously there was what we call a Section 56 exemption, which means a patient can apply for an application to the government to allow them to legally access these substances to heal a particular condition that maybe hasn't responded to other medications or traditional medications, but that has shown to be beneficial in treating the condition that they experience. So they can get an exemption that allows them to legally have access. The challenge with the Section 56 exemption is that the patient has to apply on their own behalf, which means the government now knows who they are. It's an extensive application process. There's no necessarily any response time, turnaround time in terms of how long the government will take to give you a response. And another challenge that's often talked about is that patients have to find a doctor that's willing to source and supervise and things like that too. And I would say prior to the last year, that was very challenging. Many physicians were not trained or not willing to be open about that. And another significant factor with the Section 56 exemption is that the patient had to explain why they wanted the medicine. So for many people, that's very traumatic to write out what's happened to them that causes them to want to use these medicines. In January, essentially in the fall, but it went into effect in January, there's now called the Special Access Program. And the Special Access Program allows a physician to apply on behalf of a patient without disclosing who that patient is. So they get some anonymity and they don't need to be worried. The challenge with that is that you have to find a doctor, or physician, psychiatrist who's knowledgeable enough in that area and can essentially prescribe. And then the doctor themselves fill out the application to get the exemption, and it's a very quick turnaround response rate. If I remember correctly, I'd have to double check, but I believe it's like within 1 business week, you get a response. So that's pretty significant. In addition to that, the government is putting lots of funding into research around these medicines. So there's a $3 million grant that you can apply for to study 3 conditions, one being addictions, one being treatment-resistant depression, and the other escapes me at the moment. But those are 3 significant grants that are out right now that many people are applying for.
Is it trauma related?
Yes, PTSD. I believe, if that's the.
I mean, it makes sense.
Yes, exactly. Yeah. Those are the main conditions. And studying psilocybin to treat those conditions.
Sure.
So it is specific to psilocybin at this time.
Yeah.
Although I think it's just a matter of time before MDMA is kind of the next on the list. And in the USA, MDMA is really close as well to getting approved for PTSD.
So this is something that I think is really important. One of the theme I'm hearing through our conversation so far, and that is a lot of people are influenced by the whole culture of the war on drugs that's been going on since 1960, whatever. And rightfully so, they would go, hey, wait a minute, what does this look like in terms of having some proper process? We can't go from a culture that just thinks drugs are evil and terrible to one in which we're like, hey, anything goes. Well, that's not going to work.
Right, exactly.
And so kind of this process of evolving into a new understanding, which I think is really what our episode is about. What is the new understanding that we're coming to, Anna?
Yeah, it definitely, there's been shifts, and the science and the evidence is really what's backing that up right now for many people. That's the destigmatizing agent, honestly. Knowing people, having more professionals talk about their use of substances to heal themselves, or patients essentially who have access through these mechanisms, special access programs, Section 56. In the USA, you can be a part of a clinical trial. There's some significant gains because people are actually talking about their experiences rather than hiding from them.
Sure.
So that's a particularly effective factor, and I'm sure at some point we'll talk a little bit about like what does it take to be a psychedelic integration therapist, and one of those requirements being you got to know how to navigate the cave. And so you yourself really need to have an understanding of like how could this go sideways so that you can help someone else navigate that. And yeah, so that's those are a couple of specific ways that we can work at that.
So if I could join with you just for a second, and I'm sorry, I didn't mean to cut you off.
No worries.
It's just you use this metaphor of a cave, and I'll try to be really brief. When I was in my early 20s, I went on a caving expedition, and we went with somebody that had been through many times. In southern Alberta, in the Crow's Nest Pass, there's a cave called Gargantua, and there's 6 spots that you have to rappel in, and it's massive. Like it took us 12 hours to get through, and even with the guide, then we got lost for 2 hours. Luckily, of course, he was wise enough as a guide to not tell us that we were lost until we'd found our way again. And and I can't imagine the risk of going in somewhere without knowing how to get through it. So that was a really powerful metaphor for me.
Yeah. And I just wanted to say, because you're talking about that, practitioners really have to be licensed and regulated, because there are traditional healers out there, and there are probably people that are doing this under the radar. How do you kind of gather everyone together and regulate this and also respect it from a traditional perspective too as well?
Absolutely. So particularly with plant medicines, cannabis, psilocybin, which is essentially mushrooms. These are medicines that have been used for centuries. These are not new to Indigenous healing, but we're trying to kind of amalgamate this world between present times, Western thinking, and Indigenous culture and practices regarding spirituality and wellness and healing, and how they were used originally. Is not that the person who needs healing would ingest it, but the shaman would ingest it and then essentially communicate a message that came to them. So our experience now of we're using these medicines to heal ourselves with guidance, that looks a lot of different ways. Some people will never step foot in a counseling office to do that. Some people will only step foot in a counseling or doctor's office to do that. So we have to create space for all of the potential options that people are seeking, and that can be really tricky from the perspective of Black, Indigenous, people of color, because the people in our culture right now that have the power of the voice are white male scientists, even though there's lots of people who actually have a lot more experience and generational experience. And so there's some organizations like Shakruna that gives them that voice and protects platforms for them to speak.
And so then what about for you? Since you are a regulated health professional, then what was that journey like for you to be in that spot of appropriately providing this? Right.
So there's several steps that people go through, and one of them is scope of practice. So providing information to your regulatory bodies around what is the area of practice that you're in, as well as supervision, experience, consultation. These are the things that make a professional competent. And so there's some training that I have that's like other clinicians in the province, and then there's some training that I have that they don't have, or they have trainings that I don't have. So it really kind of comes down to what's an individual looking for. But from a regulatory perspective, this is a question that comes up a lot because they're new to people. There's an assumption still that they're illegal, and that illegal is illicit and illicit is bad. There's a lot of things that are legal that are bad.
Oh, are you kidding me?
Like alcohol, sugar,
cigarettes.
Cigarettes. Yeah. So when we're using these medicines responsibly, and I'm not even say knock on wood because it seems like it's kind of a ridiculous thing to say in this context, but in many situations, there's multiple professionals that are involved. There's a psychiatrist, there's a doctor, there's an on-call doctor, there's registered professionals who are, trained, and everybody's essentially trained in some way to uphold the safety net so that someone can process.
Yeah. Well, and I guess one of the things that really comes up for me as you say this is we talk about alcohol, we talk about tobacco, and we're really talking about things that are just recreationally used. And I got to be careful here. I'm not telling people to not take their medications. It's just the trouble is there's so many drugs out there that are prescribed, and we take for granted that they're safe simply because the doctor has prescribed it to us. But actually the risks that are involved, there's a ton of risks that we don't even consider when we're taking those drugs. And they get abused all the time as well. I'm not just talking about, opiates, but there's lots of different drugs out there that when you change how you're using it, the mode, the method, how you're taking it into your body system, then it creates all sorts of highs. People abuse these all the time. Common drugs that people wouldn't even think of drug of abuse.
Yeah, I was thinking of Tylenol. Like you can abuse Tylenol, and then the impacts that can have on your body and even your mind too as well.
Sure, and like your liver gets cooked, and that's it. You're done. So.
Yeah, and from the medication, again, this is why we use multidisciplinary teams, because I, as a psychologist, a provisional psychologist, I can't speak to medication changes, but I can encourage someone to go to their doctor to speak about those medication changes.
Yeah.
So, and that's what I do. I rely on that.
Yeah. In fact, a really quick story. I had a practicum student with me at the time, and someone came in, and then I said, "You got a medication change?" I said, "Yeah." It's Seroquel, isn't it? They went, "How do you know?" "Because it's too high. You need to go back and talk to the doctor. You're slurring your words and you look like you're drunk." And of course, the practicum student had no idea. They're just like, "We have an intoxicated person walking into the room." No, not intoxicated. Well, I mean, they are.
Right.
But not from alcohol or any other thing. Their prescription drug is too high.
Yeah, exactly.
That reminds me of another story where you were, I think you were telling me that you were talking with a psychiatrist, and he actually asked you, "Oh, what do you think about?"
Oh, right.
It was a doctor.
Yeah.
It was a MD, not a psychiatrist. But it was like, "So what dose do you think?" He said, I think that you're the doctor. That's what I think."
Yeah.
Yeah, and and again, this comes back, to psychedelic work, is this framework doesn't fit perfectly in what we know of protocols and procedures. And so sometimes I am the person in the room that knows the most about what the appropriate dose is for a particular type of medication, but I can't be the final decision maker. Now, I can share that information with the doctor and have a discussion about why that is, but the doctor ultimately is the one that decides what's the dosage. And sometimes even in our consultations, because in our system, in terms of how we treat and work with people, there's a 2-door green light system. You got to get a medical green light and you got to get a psychological green light to proceed with these medications. And sometimes you don't get both. And in those cases, it's usually there's some sort of a contraindication with an existing medication that they're on, or a psychological issue in their family history that potentially could be a factor or concern.
Yeah.
But a lot of times the doctors and I are discussing what range would you consider, what range is appropriate for this kind of an experience, because we're not trying to exercise souls every time we do this.
Right? Like in fact, I think this leads into a really great discussion, so people can better understand what does this look like. Because we're not talking about, most of the time, someone laying with their mind totally gone. Most of the time, that's not what we're talking about. I think one of the parts that makes a lot of sense to talk about now is what does microdose look like, and what are the drugs that we're talking about, and how are they used?
Right. So microdosing is essentially a much lower subperceptual dose. It's much like taking your vitamins. You know your vitamins work or help, but you don't necessarily feel it working or helping. You notice shifts. You notice subtle shifts. Maybe you took a melatonin. Well, melatonin's maybe not a great example, because sometimes people take melatonin and they're just conked out.
Boom.
Yeah. A probiotic, I sort of see like a probiotic in a way. I don't feel my probiotic working, but I know it's working because I see shifts in how my body functions or whatever. This is the same sort of concept with microdosing. And so it's a much lower dose. It's meant to be taken on a particular type of schedule. That schedule is sort of decided by the medical professional and the patient. While there are some particular types of protocols, one being the Fadiman schedule, one being the Stamets schedule, essentially you have a lot of flexibility in how you want to take it with that guidance from your physician. Now, when we start to get up into like a 1.5 gram range of mushrooms, for example, then we're dealing more with like you're doing a what we would consider a macro dose. You're starting to move into macro dose ranges, which means you're going to be in a non-ordinary state of consciousness for a period of time.
Sure. In fact, that umbrella might be really good as we have this conversation. What is the umbrella of psychedelics? And that kind of why psychedelics? You know, I think if you could kind of touch on that, that would be really helpful.
It's a big one. Why psychedelics for these conditions, or why psychedelics?
And what's the umbrella that we're even talking about of psychedelics?
Sure. So when we use the term psychedelic, we're referring to anything that's got some sort of non-ordinary state of consciousness that creates I'm sure there's a much better definition. This is how I define it with clients. Things that you know are not real.
Altered state of being.
Altered state of being, yeah. That you know physiologically, psychologically, probably aren't real, but you're experiencing them very real anyways. And, you know, when we're talking about psychedelics, we're referring to anything that creates that. So it could include cannabis. For many people, that's cannabis. Smoking, you know, marijuana, THC, whatever you want to refer to it as, can produce a non-ordinary state for them. Meditative kinds of, altered states, things like that. But we're also referring to plant medicines, and we're also referring to lab chemicals, essentially, LSD, MDMA. And so it encompasses all of these different medicines that may create that altered perception. And then microdosing, each of them have different kinds of dose ranges. So when you're microdosing any other psychedelics, you need to be really clear on what's the range of microdosing and macrodosing for those medicines.
Yeah. Like, for example, if you were to take what would be a microdose for mushrooms, you're going to
look very
blow
different.
your mind out if it's LSD.
Absolutely. Absolutely. Yeah, you don't do the same. It's not a one size fits all.
Do you ever have individuals that have come in, used it recreationally, and then are wanting to use it therapeutically?
Absolutely. And they have a very interesting, typically have a very interesting experience. There's always this assumption that, I've used lots of drugs, so I know how this is going to go. And I'm always reassuring them, no, you've never done it like this, because this really requires an inner journey. And you're cutting out sensory stimulation, you're cutting out auditory stimulation, you're immersing yourself in music that's curated for the experience that you're wanting to have. You are cutting out visual input, so you have an eye shade or eye mask that you wear, so you're in the dark, essentially. But then that's where you get to explore your inner world. Now, I want to clarify something. A recreational dose can be... or recreational dosing can actually be very therapeutic. You know, if someone wants to go into the woods and do some mushrooms, that can be very therapeutic for them. It makes them feel grounded. It makes them feel connected with nature. But their intention is to be outward. So when these medicines, usually we're trying to connect inward. And when they're used in the context of groups or like religious ceremonies, sacraments, things like that, then you're going inward. You're connecting with self. You're connecting with a higher power. You're connecting with whatever's inside, not the external world, not your partner, not your friends. You're like shutting everything out.
Yeah, I often, when you say that, I'm wondering, because with this whole process, it's not, from what I've read, it's not just about going through that, but it's also the processing afterwards. Have you ever had clients do the inner journey and then do one recreationally and kind of combine the two experiences together?
I've had people who've done, say, like a mushroom experience, and then shortly after, when I say shortly, it could be like 3 weeks, a month, then they may do an intentional journey, or I've seen the opposite. They've done an intentional, like, psychological journey kind of experience, and then they've done a recreational journey. Part of that usually is because now they're beginners when they have the therapeutic journey, and then they feel more confident to navigate that world on their own. And so then they may go on to use them on their own. And this is where harm reduction really is the foundation of this work, because we're not going to stop people from using these substances. It's everywhere. Social media is saturated, podcasts are saturated, everything is saturated right now with psychedelic information. And so people listen to those things or read about it, and they decide that that's what they want to do for themselves. And so really what we're doing as integration therapists is we're trying to create harm reduction. We're trying to, not everybody that comes to me is actually using these in a clinical setting. They're using them on their own. They've already used them on their own. They've had not so great experiences that they're trying to work through and process. So we're essentially giving them a safe space to speak openly about it, to seek guidance. Many times I've had people come in searching for a particular type of experience, and I've essentially sort of said, here's some things to consider that you haven't. Like you've read or heard about this and you think it's great, it's glorified, but like here's the shadow side of that. And you need to consider who your guide is. You need to consider your setting. You need to consider the fact that you're a woman. You need to consider the fact, there's all these factors that I don't think people are considering when they're reading or watching or listening to media around these medicines.
It's a really good point, because often we think that we just gain knowledge, and it might sound like I'm splitting hairs, but actually what you're looking for isn't just knowledge about a specific thing that is sufficient. You need someone that has wisdom.
Yes, exactly. Because you can learn something, but sometimes our learning is on the other side of a bad, experience. Well, in psychedelic medicine, we refer to them as challenging experiences. There's no binary, right? Especially with a non-ordinary state.
Yeah, kind of getting lost in that cave.
It's funny you say that, because having been through this myself, having had treatments with ketamine, and seeing the possibility of falling off a cliff inside my mind, it's funny you would say, hey, there's no bad experience, there's challenging ones. I'd be like, I don't know. That I was on the edge of bad. Like it could have been really bad.
Yeah. And of course, if someone came to me and said, I had a terrible experience, I had a bad experience, I wouldn't be like, well, no, it's not bad, it's challenging. I would not do that. But, as a clinician, we have to stay grounded, even if it feels really like, oh man, you had a bad experience. We can't be like that. If the
Sure.
guide in the cave had said, oh man, we're lost.
Yeah, exactly.
Then it'd be like, what are we going to do?
Exactly. In fact, it wasn't until I was like, hey, look, that boulder is the boulder we peed behind 2 hours ago.
Yeah.
And I looked up, hey, wait a minute, there's anchor points. That is the boulder we peed behind 2 hours ago. What's going on here? Oh, no, I know where we are now. Let's go.
And then when you get out, he's like, hey, funny story about that.
We were lost 2 hours.
We were actually lost. So I use the language just like I would in traditional therapy. I use the language that my clients are using, but then I can sometimes help them find meaning in what's occurred, and that's where it goes from being bad to being challenging, is that you find meaning making.
Sure. Now I'm wondering if this is okay, because I'm the way you looked at
the way
me
I look
when I said my own experience, I never said that I was going to even talk about it, right? But hey, if we're going to destigmatize something and we're going to humanize our experience, then I have no problem in saying that I lived life for many years not happy, and it's not an ultimate thing. It's not an all or nothing, right? It's not like I'm either happy or I'm horrible. There's all sorts of good stuff along there too, but my own experience was one of an injury that caused chronic pain, and then going through, this is why I said, hey, there's risks to all sorts of different medicines, because for me, the prescribed medications caused horrific side effects in which I felt more intoxicated than I did from some of the stigmatized medications that I've used since. And that caused all sorts of roller coaster of emotion, terrible experiences. Here I'm a therapist and I'm sitting there going, I've lost my will to live. What is this about? Oh, yeah, I've been ramping up on this medication over the last 2 weeks. I have to actually understand that my feelings right now are not valid. Now that's a
not
weird.
valid.
That's a weird
yeah.
thing to say.
Yeah,
I have to
yeah.
understand
That's a shift.
that these medications that I'm on are causing me to feel this way. I need to not act on these feelings and get help to get off of this medicine, so that I can find another more healthy way.
Yeah, and I think that that's something like that a lot of people struggle with, like recognizing that and saying, okay, well, because you can recognize that as a therapist because you're steeped somewhat in medications, but it's for a person, I don't like these feelings. Okay, well, then I'm just going to go off the drugs. No, wait, I need to actually go to my professional and we need to slowly wean off because who knows what could have been the impact if you would have just stopped right then and there.
Yeah, exactly. In fact, I called to find out, and they went, "Would you like hallucinations?" Like they didn't quite say it that way. They went, "Well, the effects are
depends on
you
what
could
the
start
medicine
you
is
could
that
start
causes them."
hallucinating," and I was like, "Oh." Yeah, I don't really want that. So how do I get off of this then? And a lot of people just feel stuck because their doctor prescribed it. I got to wait for an appointment. No, you don't. Call the pharmacist, speak with them, tell them exactly what is happening and that you want a plan to come off, and they'll work with you as well if you're having those kind of problems.
Absolutely. Pharmacists have a great degree of knowledge.
They do,
Yeah.
actually. Very untapped.
Yeah. So with this, and I find this very curious because maybe it'll give a little flavor into the process. Anna, I think that it wasn't even that long ago, within the last few years, that your idea of these same drugs was rather different than it is now.
Absolutely. Yeah. I mean, I come from the U.S. where, the dare to say no drug slogans and
Winners don't use drugs.
Right.
Drugs are bad.
This is your brain on drugs in the frying pan. Every time I cook an egg, legit, to this day, every time I cook an egg, I immediately think of that
like
slogan.
Psilocybin.
Yeah. So yeah, my mentality around these substances and I have some personal experiences in my family background with addictions and things like that. And so, I was very much of the, drugs are bad. That's it. Plain and simple. And so when I moved to Canada about 14 and a half years ago, I was working with a population that cannabis use was very common and nobody seemed to really care about it. And that was a real struggle for me because I kept kind of getting hung up on this, but we can't do anything because they're on these drugs. We can't do anything because they're on these drugs. We can't help them until they get off these drugs. So it was this mindset of like abstinence and, a lot of work and a lot of being open and a lot of actually learning about the variety of what addiction means, what is substance use. Really good book called Drug Use for Grown-Ups by Dr. Carl Hart. He's, I can't remember exactly what he is, a neuroscientist, maybe something. I'd have to look it up. But anyways, it really, I had to shift my mindset.
No. I just
saw the smile.
I have a thought. I have a question, but I'll wait until she's
Sure.
done.
That's okay. Yeah, so I'll just make it quick. So yeah, essentially I came from an abstinence mindset, dare to say no to drugs. Drugs are bad. Drugs are illegal, so they're really bad. To being a psychedelic integration therapist and helping people use drugs for drug addiction.
Yeah.
That's
for sure.
the far other end of it.
Yeah.
Is now actually we're going to use this to help you get off of that.
Well, and just bizarre things. I'll let Trent speak in a second, but just bizarre things where that spot around cannabis is bad, but Ativan is good. Like we're going to have somebody that is going to come off. They're going through the DTs. Now, Ativan saves their life because they don't have convulsions, except that cannabis can do the same thing.
Right.
And then why is that one bad then?
Yeah.
Like, because it also reduces seizure activity and has a calming effect, but you could use it for 2 weeks and not become dependent on it.
Right.
So anyway, go ahead, Trent.
Oh, I just want to say, as soon as you said that, it made me think of the saying, the good the bad and the ugly.
Yeah.
No, what I'm really curious about, because you went through this shift, I'm wondering about, like, as you went through this process, what was it like for friends and family members that knew you as this, like, anti-drug person to now see you explore this, and what impact did it have on their perspective?
I don't know if anybody really knew how rigid I was on the thinking of it. As a clinician, our jobs are to stay really neutral and not be really vocally saying, well, I agree with this, I don't agree with that kind of thing. And so I don't know that people really understood that of me. I actually think people probably assumed that I was always kind of open-minded because of just how I look and carry myself. Tattooed, colored hair, piercings. So I think there's this assumption that I'm always like on the fringe of things, but I'm not. I really have to have evidence on why something is the way it is and why it needs to shift. So my journey realizing abstinence was not an effective model with the population I was working with, and then just understanding and being honest with myself about what are my own biases in this work. Eventually I started to kind of consider the possibility. It actually wasn't until I had my own experiences with psychedelic medicine that I was like, oh man, I have had this all wrong.
Interesting, because I don't know how much you would like to share in detail. Certainly, I'll be open about my own experience in working with these medicines myself. But
yeah. I think for me, journeying is a very personal experience. I can say, though, that I resolved considerable issues around confidence within myself, childhood traumas, really difficult ending of relationships as an adult that affected not only my lives, but my children's lives. And I used a variety of essentially medicines to help me journey. Now, the other thing that I think people assume is that we use these medicines all the time. I literally can go years. I don't sit in like every weekend, trip on mushrooms. My kids tease me a bit because I talk very openly about the work that I do, and they're very aware. And initially though, it was like, hey, we're going to go to our dad's this weekend. Are you like going to do mushrooms? And I'm like, what? I'm going to clean the house and watch Netflix. So it's also this assumption that, you're using these substances all the time and that you're, you can't stop using them to resolve your life issues. And that's just simply not true.
Sure.
So I've used them very intentionally throughout my life. Again, like I said, you have to be willing. You have to be willing to navigate that experience before you can truly guide someone through the experience. Now, with that said, a non-ordinary state, I'm not saying everyone has to do psychedelics or, LSD or
Sure.
MDMA. What I'm saying is that we get into non-ordinary states all the time.
Yeah.
Dancing, drumming, floating, meditation, zoning out while you're driving across town. You're sort of in a non-ordinary state. So, we have to be careful to not put everything into one box.
Yeah, for sure. Like I use hypnosis for healing all the time.
Absolutely.
And you talk about ketamine, or you talk about hallucinogens, and actually in hypnosis, those that really get into it will have full-blown experiences where they feel everything as real.
So, I'm wondering with you, what is one of the without breaking confidentiality, of course, can you think of one of the most powerful experiences that you've ever seen somebody go through using these substances?
That's a little bit tricky because, I don't want to share anyone's experience specifically, but I can give you just sort of a general kind of observation. I've seen people who were atheist come out really feeling connected to God or source, however they define it. But they have these really profound spiritual experiences, particularly with plant medicines. I've seen or heard of people who went in with an intention to work through some sort of trauma, and then suddenly they're no longer wanting to smoke cigarettes.
Interesting.
Like it's like a side effect that fixed their addiction, and it wasn't even part of their intention. I think for what I've been able to see with people is a profound shift in their understanding of their trauma. I think that, to me, has been one of the most powerful things that I've been able to see. No two sessions are alike with the same person. I'm working primarily with ketamine at this point, just because some of the other options are, while there's interest, they don't happen frequently.
Yeah, and it's just barriers are a little bit more for the other.
Absolutely,
other things.
yeah. There's a process, right, to acquire the medicine. There's a process to meet with the doctor, get the applications going, whatnot.
Yeah, the least barriers are with ketamine right now.
Right.
Which actually is one of the most stigmatized of the drugs that we're talking about. So that's curious.
Mm-hmm. Yeah. In Alberta, we're sort of ketamine is really only authorized for use for like emergency surgeries, anesthetics, in terms of if you're going to have dental surgery, right? You're going to get your wisdom teeth taken out.
Or it'll be given in combination. I can't remember the other drug when someone gets their arm set.
Right. So, and the thing about ketamine is that we use it with children. It's used in the hospital all the time with children. So this concept that these psychedelic medicines are for adults only, that's not actually true. And there's lots of fascinating research going on with MDMA and psilocybin working with children who are autistic or who have brain conditions that they struggle with. So, this is much like prescription medications that they're good for adults and they work with adults. So we start using them on kids, but we don't actually have any research to support that. We just go, it works on the adults, so it should work on the kids the same way. Yeah.
I mean, even the DSM, like it's mostly built off of adult data. So,
right. Exactly.
And then we're using that to treat children. When their physiology isn't the same and so forth. Yeah, for sure. If it's all right, I'll share a little bit of my journey.
I would love to hear this. I was actually surprised that you said it. I was like, oh, did I miss the announcement that Jeremy's done ketamine?
Yeah. So in brief, so I grew up in a very religious home. And a member of the Church of Jesus Christ of Latter-day Saints, the nickname Mormon, and so people, when they hear that, they go, I can't even believe you would even try that, because the notion of the rules around what is appropriate and what isn't appropriate, and so that was a big barrier to me, but then. In my life, I got injured and I just never got better. And after living year after year after year, just in pain every moment, I started to wonder if there was some other way, something else that would be possible. And it started for me with cannabis, and I got connected with a doctor here in Medicine Hat. And he educated me in a big way that I just didn't understand. It's like, basically, the plant says doesn't heal you. That's not the intent. We need to get this right to set the circumstances for you to heal yourself. And what he said to me is, if you broke your arm and you go into the hospital, the doctor doesn't heal your arm. He can't heal your arm. You heal your arm. It's just that he sets the circumstances for it to heal properly. He says, and that's what we're trying to do here. So when you see these people that seem to be, and I don't mean to be disrespectful, but in that addiction cycle, they're overdosing. Now, you can't overdose on cannabis. Like, you can't die from the overdose. He said, but they're just numbing themselves out, and we're not going to do that. So we started just with CBD. and it didn't touch my pain. So then eventually he said, okay, why don't we try ketamine? And he gave me some information about it, that it's like, this is neuroregenerative. He says, okay, what's going to happen is we're going to dissociate your nervous system so much that is going to allow it to now reconnect again in a new way, break down the superhighways that have formed from your nerves continuing to always fire in the same way. And now the amazing thing is then when I got the injection, then I sat down I was already sitting in the chair, and I was given the injection. And then I went, wow, why are my hands on backward? And it was like 90 seconds. My hands are on backward. No, interesting for me, because I went through about 8 treatments. I might be a little wrong, but I think somewhere around there. Is I seem to flow through different periods of my life. The first one that I went through was when I was a kid and I was having night terrors, and those same images came back into my mind, but they weren't terrifying anymore. You know, I could sit there with them knowing that I'm okay. And that's that duality, right? Of I'm present, but I'm back where I was. And you can show up as your adult self to assure your younger self. Yeah. We're gonna go parts. You know, sorry. we're into working with parts. No, the interesting thing about this as well is the doctor is really clear in saying, as he followed up with me, here's something to journal with. But in the recovery room, he's like really just saying you can share whatever you like, but just know that I'm not a therapist. And he's really just trying to get the zone right. He's like, okay, I don't want to blow your mind. I need you to still be with it enough that you can process through this, and the pain that you have trapped in your body can be released. If I push it too far, we're not going to get there. And if I don't have enough, we're also not going to be in that right zone. So yeah, you're too disconnected. We don't want you to go to sleep. We don't want you to be so disconnected that nothing's going on. You know, the difference between like an emergency surgery or a planned procedure surgery where we're using ketamine is 4.5, I think, per kilogram of weight. And with ketamine-assisted therapies, we're in the 0.5 range. So it's much lower. It's intended to keep you alert and awake enough that you can remember what happened, that you are sensical. And so, but because ketamine is a dissociative, you have experiences where you feel disconnected from your body, like you can't move, which can be traumatizing or triggering for trauma patients too. So we have to do lots of preparation, feeling frozen. But even people who haven't had that, it's disarming to feel like, why are my hands on backwards? Or why can I not move? Yeah. And so every single time after that, I was like, okay, no, I'm in because my hands are on backward.
Yeah. Well, it almost reminds me of almost like a waking dream, or almost on like the edge of sleep. Yeah. Because I forget which stage of sleep where your body is actually paralyzed. Yeah, that definitely happens. And that overlaps with hypnosis. Hypnos is the god of sleep. And when you're in a really shallow sleep, that's when you have vivid dreams. Or if you're just on the side of wakefulness, then you'll have vivid dreams. So it's the same sort of state we're trying to create with hypnosis. Interesting.
Yeah.
See, now I almost want to get people in an MRI machine that are doing both and then compare and contrast.
Yeah. Just quick thing. Tomorrow, actually July 12th, they're releasing How to Change Your Mind, which is a 4-part series on psychedelics on Netflix. And one of the episodes has someone that's connected to a machine, so that you can see what's actually happening in live time with their brain. And in the research that we're doing, we're going to be doing pre and post fMRI scans too. So it's very exciting to see what's going to be happening in the brain, whether it's lifetime or pre and post.
Thank you for filling up my Netflix queue.
Right?
Yeah, tomorrow. Yeah, July 12th. I think it's going to generate a lot of questions. It's definitely going to generate a lot of interest. This is where the huge burst and hype came from, was from this book, How to Change Your Mind.
Yeah.
And that's where everybody's like, oh, I read this book, and so now I want to know more about this. And so now they've put it into a Netflix series. 4 parts tomorrow, July 12th.
Yeah. Order a pizza with, ham.
I really want to
and
do a
mushrooms.
watch party.
They don't put that kind of mushroom on a
Not
pizza.
that kind of mushroom.
Okay.
Just regular, adaptogenic, healthy mushrooms.
Even in my own process of just trying to get people to understand, I have nothing to be ashamed of. I'm not concerned that someone knows that I had ketamine treatment. They can't see my pain.
Right.
And I recognize that. I look normal, but I'm not.
Yeah.
And so it's okay. Whatever method that I'm going to use that is going to be healthy is going to be important. In fact, I was walking away from a treatment, walking back down to our office, and I got a phone call from a colleague that's a doctor that wanted to make a referral. And I said, "Hi, I'm sorry. I'm like 40 minutes out of a ketamine treatment. My head's not right at this point. Can I call you back in a couple hours and I'm going to be clear?" And because I wasn't afraid. Afraid for this person to know. And that position around addiction, well, I'm not getting ketamine treatments anymore. And guess how much withdrawal I had? 0. I got to just stop.
Yeah.
And in consultation with the doctor, I'm going, maybe we don't need to do one now for a time, as he had this bigger treatment plan that was part of my process. And living in a place in which I'm 70% free from pain, it saved my life because I was living as a gray man for much of my life. There was no point.
I was just going to say, I remember after you did your first few treatments and you came over to my house, and I could just see the difference in your body. It was unbelievable. The stillness that you had that I've never seen before. Because if you ever know Jeremy, and if you ever spend enough time with him, he moves around
constantly.
so much. And, it's not just because of the ADHD. I knew that it was because of the pain.
Yeah.
Shifting, right?
Yeah.
Trying to find this optimal position you can stay in more than 5 seconds, and if I just keep shifting, I'll be able to stretch out some comfort, but I have to keep shifting in order to do that. Yeah.
Yeah. Even if you look at me now, I'm just still.
Yeah, you are. Yeah.
Just present right in the moment.
Yeah. And I think, for these medicines, it really is important to know that your relationship to the medicine. So you probably notice I refer to it as medicine, right? And so your relationship to the medicine is super important too. I don't know many people that sit with their Ativan or their clonazepam and set an intention and want to connect with themselves. Usually we're like, disconnect, please disconnect. I don't want to feel this. I don't want to feel this. So it's a shift in mindset around what you're using. How you're using it, why you're using it. What's, intention essentially is what's your why? Why are you doing this?
Yeah.
And we don't do that with regular prescription medications.
I wonder if we could.
Or it might be a good idea for us to know why we're taking and be more mindful of what we're trying to accomplish.
Yeah. I mean, you don't have to do it with psychedelics. You can literally do it with anything that you do. Why are you drinking the water that you drink? Why are you going to yoga? Why are you drinking beer on a Friday by yourself or whatever, right?
Sure.
What's your why? Yeah.
And in fact, I want to throw one other thing in, and this, I can't say that I'm just taking this and I can transpose it into someone else's life. It's just that in my journey, recognize I wasn't just in pain and then I'm looking for a doctor to fix it. That's not what happened. I spent, and I still do, an hour and a half every single day exercising, in doing very specific body movements, in doing specific things that are a part of that wellness. I couldn't just show up and expect the doctor to fix me, except that my body was trapped. It was stuck. it didn't matter if I continued that for years, I wouldn't get out of it without something to assist it. And now, when I do those same things, whether it is stretching or yoga, all of a sudden my body's moving in a way that it couldn't before. And these gains from the wellness that I am doing myself are possible that couldn't be possible without the additional help.
Mm-hmm.
Yeah, it makes me think of when I've done some reading on how they see the medicines as traditional. In some cultures, after they take it, the person is seen as a brand new person.
Mm-hmm.
Yeah, and basically they're given that time for the default mode network of the brain to really reconnect.
Yes.
And I can almost hear that in your story. Like you were a brand new person. You weren't the same Jeremy that you were before the pain. You're someone new.
Well, yeah, integrated.
Yeah,
there's parts of it that weren't divorced anymore. Mm-hmm. Yeah, and I guess that is a new entity, isn't it?
It is, because while it's the same, it's different. Mm-hmm. And again, it requires you to be very mindful to notice those shifts. There's, kind of a funny saying in the psychedelic realm. It's called shifts happen, or shift happens. So you're looking for subtle shifts. We're not looking to have people 180 and totally change who they are. We're trying to maintain the essence of who they are while essentially shedding the parts of them that are not working for them anymore, and giving them another perspective and a new insight into understanding that integration is the Greek word for whole or wholeness. Mm-hmm. So it gets in, and we can integrate anything. It's not just psychedelics. We can integrate when a kid is learning to decode and they're reading letters, they're learning to read, and then they integrate that into the reading process. Mm-hmm. Like everything we learn, we're integrating into change, or learning it better, or doing it different, or whatever.
Yeah. I just want to get that put on a shirt now. Shifts happen.
Shift happens. Shift happens. I know. I can't remember the gal. It was actually like a university student that kind of came up with that, and it's just stuck in the realm. And I'm like, it's the best bumper sticker. Like, yeah, put some little molecules of psychedelic medicines or something. But yeah, I mean, from a cultural perspective, my background, like I'm Mexican, and mushrooms were really sort of shared with Westerners from Mexican culture. So I feel personally particularly called towards mushrooms. And that's been where I have felt like I've become more myself. And again, they're not used often. I count on one hand how many times I've used these medicines. And does that make me less knowledgeable than someone who's used them 50 times? Not at all. I think I read something recently. Will Smith had used ayahuasca like 14 times or something over like a couple years period. And my mind kind of questions that, but then I go, okay, well, for whatever reason, he felt that was his journey. Yeah, so it's not up to me to judge that or interpret that in any way, any more than it's really helpful for someone to judge me because I say I've used psychedelics. Well, they don't know how many times. They don't know why. They don't know what I've gained from that. If anything, I've shed expectation. Now, while that can be inconvenient for people who really want me to behave a certain way, it works really well for me because I don't feel like I'm under the heaviness of obligation to be something that I'm not.
Yeah.
So it's helped me put boundaries in place with myself, with others. It's changed who I am to be more aligned with who I am before I even knew who I was.
Mm-hmm.
Interesting.
As we talk about this, one of the things that really jumps out at me, to be able to, for some of our listeners that might have something stuck, and one of the things I would say to them is there's lots of different ways to heal. So don't think that this is necessarily the one.
Right.
It used to be, and you hear this a lot. I got sick of getting a referral. This person needs CBT.
Ugh.
Oh, that's what they need. Okay. Well, I've had a lot of people heal in that method, but it's not necessarily the method. And I think right now you hear a lot of this person needs EMDR. Well, that's what they need. There's actually lots of different ways that people resolve concerns. And so I would say to the people that are listening that feel stuck, don't think you're not trying.
Right.
It's like, I drive up to somebody and I see that they're stuck in the mud and they're out of their car, and I just assume you just sat there not trying to get out. Well, of course not. You think they just sat around not trying to get out?
Right.
No, they've been trying to get out of the mud all this time.
Yeah.
Just the fact that I came and happened to have a tow rope and could give them a little bit of a tow for them to get traction doesn't mean that they weren't trying the whole time.
And it doesn't mean, that you didn't try other things either. I think that, again, there's just a lack of understanding around, if we're using psychedelic medicines to treat people, then we're not using evidence-based practices. And that's just simply not true. I use EMDR all the time in integration. I use CBT when they're at a place of I function off a triphasic model of trauma recovery to treat patients. And so in that third stage where they're reconnecting with life, with themselves, with their families, friends, whatever, that's when I'll use CBT. So I do use CBT. I just hate being told that CBT is going to help a trauma victim. And so I do just get this like puke face. You guys can't see me that are listening, but these guys in the room can see me. I just like roll my eyes so loud that you can hear it because I hate
scraping.
I hate CBT. As the end all be, I'm like, okay, let's just put that on a pause for now. We'll come back to it if we can.
Yeah, it's kind of like that old analogy. If all you have is a hammer, then everything looks like a nail.
Yes.
This reminds me, one of the great CBT granddaddies, David Burns, for a long time, I was like an acolyte, and I got a chance to meet him, and it was very interesting because two things really stood out. One is he said that cognitive process is not the whole thing. Now, his way of understanding it was he called it hidden emotion. And that really what I would say is, this person's body and their cognition were not lined up. And when they found that spot where the emotion was stuck and the cognition could then recognize what it was, all of a sudden now people get better. Now, but the other thing that stood out to me is he talked about treating like PTSD in a matter of a couple of sessions. Now, the thing I didn't say, but I wish I had, and David, if you listen to this, then this is what I wish I would have said. And that is, actually, Dr. Burns, I think it's something about the way you are, not the technique. Because there's something that is just healing about this kind and gentle man.
Nervous system to nervous system.
Yeah. We trauma often happens in the form of relationships, and it heals in the form of relationships too. So, this concept that, I think of even like well-known contributors to the field, Bessel van der Kolk, he's actually sits on an MDMA trial for PTSD right now. I mean, this is the big daddy of trauma.
Yeah, the guy
recovery.
that really got trauma into the diagnostic manual.
Yeah, exactly. And he's a big advocate of neurofeedback. He's a big advocate of several different types of modalities, somatic experiencing,
drumming, chanting, drama.
Yeah. And so there is a really interesting podcast where he shares his experience of using MDMA to treat his non-existent trauma that was actually quite traumatic. and I think at the last International Trauma Convention, he spoke of his experience as well. So again, that doesn't mean he's abandoning his trauma treatment model or other trauma treatment models. Like, I'm a big advocate of somatic experiencing. I use that every single day with every single client, regardless of what they're coming for. So an IFS, which I want to be careful that, Trent and I don't start geeking out on that. Yeah. That's a whole other podcast, maybe.
Yeah.
But once again, Bessel van der Kolk, right? In which he's saying, hey, wait a minute. This particular methodology is about an individual whose parts are not integrated. Well, then if we can do that, then we treat the trauma, or you might say cure. I believe in cures.
Mm-hmm. Yeah, and I believe that can happen as well. And Gabor Mate is another one I was just on a call with him not long ago, and it sounds so weird to say that out loud, actually. Just talking with him about like, so how do you help people that don't do this work understand that it's okay to be curious? We don't need to make people jump on the bandwagon. We just need space to carve out our own niche. So he had some really helpful insight. But he's experienced some lashings.
For sure, right? Like, interesting enough, because he also came from treating like the epicenter of the opiate crisis in, East Hastings Street, Vancouver. So if anyone understands the risks that come with drug and drug addiction, not just drug addiction, but addiction in general, it's Gabor Mate.
And how it relates to trauma, right? Mm-hmm. And then that trauma recovery being the catalyst, no matter how you get to it. I mean, I'm a single mom. When I got to fix stuff in my house, I know I have a hammer somewhere, but I don't always know where it is. So I'll pick up the wrench and use it like a hammer. Mm-hmm.
We use the tools we have. And that doesn't make it any less effective that I'm using a wrench to hammer a nail into the wall to hang a picture. Not at all. It works the same. It's just as effective. So it's about how do we broaden our perceptions? And again, this isn't about, if you don't want to do this work, then don't do it. For sure. Yeah, absolutely.
Nobody's trying to make you.
Like, when cannabis was legalized in Canada, the sky didn't fall.
Right. One day it was illegal, and the next day it was legal.
Guess what? The sky is falling.
Yeah.
Actually, no. Have you looked outside? It's still there.
It's still there.
Yeah. People weren't walking around stoned, and we weren't all just cooking the world's giant brownie.
Yeah, right. and there wasn't like a whole bunch of automobile accidents that increased and so forth. Those things didn't happen.
Right. Yeah. And I will say that I do think that there's probably arenas that have been impacted, like perhaps youth increase of usage with cannabis has happened. But we don't know for sure without having that information and knowing what kind of the baseline of that was. But I can assure you there are far many youth in this community and other communities using mushrooms. Mushrooms are the thing that they think is better, actually. And it goes sideways sometimes, and they need support. And so they have to have a place that they can go talk to someone about it, because if they don't, then they actually end up potentially having far worse impact on that.
Yeah,
and
sure.
So, yeah.
And so that position, it really comes to understanding that punishment neither teaches nor does it heal.
Yeah, and we haven't touched base on the inner healer, and maybe that's a conversation for another time. But it kind of goes back to what you were saying about the doctor saying, "I'm going to set the conditions for you to heal," but you essentially are the healing. I think to me, this is the single most handedly important factor of all of this work, is that I don't fix anybody. I don't heal anybody. I provide the condition for them to do that themselves. And to see someone's face when they go, I know what I need to do. I know myself better than I've ever known myself. Or I heard this voice. And then when I asked them, whose voice was that? They're like, it was mine. And so that's so powerful.
Yeah. That makes me think of the one... I was going to say meditation, but the one hypnosis journey that you do, Jeremy, with the wise old man.
Oh, yeah. So that one is really from Gestalt. It's a guided imagery, but yeah. And the wise person, yeah. Mm-hmm.
And in EMDR, we use a nurturing figure, a protective figure, a wise figure, a peaceful place. We use these resources. These are internal resources that we might connect with externally, but they may be internal resources as well.
Yeah. So I can't believe this. It has already been an hour and almost 10 minutes.
Oh my gosh.
I know, right?
See, this is why we need to do part 2.
Right.
So
I'm going to be interested in part 2 because I want people to watch Netflix. I want to see what questions come up because I want to be able to answer them.
Yes. In fact, I think this is where we really want to put this plug in, and that is anyone that's listening to this, we want to know what you think. Please, doesn't matter, good, bad,
ugly.
yeah, we actually really want people's opinion in terms of understanding about this. So if you'd please go to humanizingmentalhealth.ca, then you'll see a link there to be able to email us, and we will respond to questions in part 2.
And we can keep things anonymous. Nobody's name is going to be shared, but it is a bit of a rare opportunity to be able to speak to someone that's actually working, or has worked in the field, and get those questions answered, which is what I'm hoping to do, is to provide information and education around what we're doing, what we're not doing, what's this all about, Yeah, and there's going to be some people that are offering this service who've never done a psychedelic for lots of reasons, and that doesn't make them bad or wrong. It's things to consider.
Yeah, and so we'll put this in the show notes as well, a link that'll take you there.
Absolutely.
And I really feel strongly right now that it's important. Someone out there needs this message, and that is, you can heal. You don't have to live, whether it's emotional pain, whether it's physical pain, you don't have to live with it all of the time alone. And whether it is EMDR that you find that healing through, whether it's cognitive behavioral therapy, whether it is psychedelics, the method isn't what matters. It's there's a lot of different ways that people get to the same place. And we just want to have more opportunity for more ways of healing that are healthy for people.
Absolutely. Jeremy, that was a perfect way to end part 1.
Yeah, so
To be continued. Dun, dun, dun.
any last thoughts from you, Anna?
No, this has been great. I feel like there's so much I want to say. How to make it digestible. I think while I have the things that I think are important to communicate, I think the best way to communicate it is to find out what's important to other people and start there. Because if I'm sharing things that don't matter, then that's not helpful.
Absolutely. Although I'm sure that there's probably information that people would not even know, not even know that they wanted to know, that you would probably share.
Yeah, you don't know what you don't know. And so hopefully people have listened and learned something today. And I always learn something when we do this. So it's just a much better method than me standing in front of a room and just talking at people. It's a conversation. So now I think it's just engaging that next level of the listeners.
Yeah. On that note, I was going to say I'm definitely going to be watching Netflix tomorrow. I'm going to be having my, my soda and my popcorn.
Yep.
And afterwards, I might listen to some Grateful Dead, because you never know. that was the one thing, because, I was like, when you told me about that, I went to my parents and I was like, can I maybe borrow some of your albums? And they're like, why? And I was like, because it actually works.
Yeah.
Yeah.
The music is a whole other thing, and we'll talk about that maybe next time.
Yeah.
The music is so, pun intended, instrumental in the process. Like what people garner in their journeys from the music is,
I don't know. I'm trying not to make the podcast longer,
I know.
I'm just kind of sitting here saying, because that's what the people experience. I wonder what the musician experiences when they play it, and the connection with the crowd,
Particularly live. Yeah. Yeah, because everybody in the crowd feeds their energy into it.
Oh yeah, yeah. It makes me almost want to go to a live concert and say, what am I feeling right now? Yeah.
Yeah, and that's the feedback that we get oftentimes with people. It's either they feel like they are the music, they are in control of the music controls their journey, or the music is like this whole other entity of energy. And it's always super interesting to hear people talk about that. And we refer to it as the wind in your sails during a medicine journey. Because if we want to excavate some skeletons, then we use certain kinds of music, but it really depends on the person. So It can't be like a one size fits all.
Yeah, for sure.
No.
Like one last thing I would share about my journey, and that is,
Sure.
it seemed like I was going, through stages of my youth. Well, it's like the third time. Then at the end of it, I said, "Hey, was Pour Some Sugar on Me playing?" And they said,
Probably not.
No, Pour Some Sugar on Me was definitely not one of
Yeah.
the things we played in your. So then, why was I listening to it?
Okay, let me guess. That was teenage Jeremy.
Yeah, that was 12-year-old Jeremy. Yeah.
Oh yeah.
Yeah, well, the music or the medicine gives you what you need, not what you want,
Yeah, I wanted some sugar apparently.
and to pour it all over you. Apparently.
Apparently. Yeah. Anyway, so we'll wind up today. Thank you so much for listening. We hope that this has really resonated with you.
I'm Trent Akers.
I'm Jeremy Alcorn. This podcast is intended as general information. We are glad that you joined us today. We hope this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health or at humanizingmentalhealth.ca. Humanizing Mental Health is a plugged-in media production.